Hi there. Um, my name is Margot Foey, and today we are going to be discussing the immediate care of the newborn after delivery. Times are changing, and we all know that because of staff and everything, we are pretty much going to be the labor and delivery nurse now instead of having someone there to catch our baby, and it's going to be us. So we really need to become comfortable and accustomed to doing the initial newborn care on a baby that is uncomplicated. Okay, so I have a PowerPoint to share with you today. The objectives for this course are: upon completion of this unit, the staff nurse will prepare the anticipated equipment for normal delivery care of the newborn. Upon completion of this unit, the staff nurse will be able to perform the initial quick assessment of the newborn. Upon completion of this unit, the staff nurse will be able to assign APGAR score at 1 and 5 minutes of age with 100% accuracy. And upon completion of this unit, the staff nurse will demonstrate the appropriate nursing care to the neonate immediately after birth by maintaining a patent airway, preventing heat loss, and promoting parent-to-infant interaction. Upon completion of this unit, the staff nurse will establish a protective environment for the newborn to include proper identification procedures and support of the neonate's physiological functions. How does that sound? Any questions about what we're going to talk about? Okay, great. So, in anticipation of our delivery, we're going to have a radiant warmer turned on and heated. And this is really just in case now, because evidence-based practice shows now that the baby should go to the mother's abdomen, and there should be delayed cord clamping. But even though we're having a delay in cord clamping, it doesn't mean that we don't put the warm blanket on the baby while it's on the mother's abdomen. So, in studies that I've read in preparing for this, they are recommending delayed cord clamping up until the ending of pulsation of the cord, which could be up to 3 minutes. So that's a pretty long time compared to what we're all used to. So, the only reason we have the radiant warmer turned on and ready is just in case we were to run into difficulty with the newborn, that we would have to put it on the radiant warmer to resuscitate it. Okay, you want to have suction. You'll have your wall suction, and also a bulb suction, and warm blankets, and a hat. The neonate loses an extreme amount of heat from their head, so you want to apply that hat immediately, which, I'm sorry, I don't have a hat available. Gown and gloves for you, and a bag and mask with an oxygen source, which is right here. And you always want to make sure this stuff's on and ready to work if you need it, just in case. And the stethoscope. And can any of you think of anything else that I might be missing here? Anyone? Okay. You're my anyone.
On your anywhere?
Okay. So next, moving on. Let's say that the baby is born, and I don't have a mother here to...
I'll be the mother.
You'll be the mother, okay. So the baby is born, and we're going to put the baby right on your abdomen. And, well, I'm not, the doctor is, but so they're waiting, cord clamping, but we can come up here and go ahead and try to dry the baby a little bit while they're waiting. And once they cut the cord, depending upon the mom's choice, the baby can either go to breast or just lay on her chest, skin to skin. And while the baby's laying there, we're going to be assessing just very quickly, is the baby crying? Is it breathing? Do we have good muscle tone?
No sounds.
There's no, okay. Well, so we have our bulb in case we need to suction, and you always want to suction the mouth first, and then the nares. Okay. The reason you want to suction the mouth first is so that nothing from they don't take a big breath in of what's in the nasopharynx. Okay. So, as long as the baby is breathing or crying and it has good muscle tone, it can remain on the mother's abdomen or taken to breast. And at 1 minute of age, you can look at the clock and see it's been 1 minute, and you're just going to think about your APGAR scoring, okay? Which is part of that initial assessment there. And we're going to assign the value. You just have to be thinking about it, because you don't have to chart it right now, because we're still going to be looking at the baby and we don't really have time to run over to the computer to chart it. But you just want to check for the A stands for appearance. This has the baby's color. The pulse. The pulse. You can either check the cord, because it will still be pulsating right up next to the skin, or you can take your stethoscope and listen to the baby. Grimace, or if the baby's irritable, is the baby crying? The A is for activity, which is the muscle tone. Are we hypertonic? Are we hypotonic? Or just appropriate? And then it's respiratory effort. Do we have good work of breathing? Is the baby breathing okay? And if not, we will, we can assign the scores with this chart. Okay? This is actually an expanded APGAR score form, so it's not something like what we see here at research. But it is pretty neat, and it's got even resuscitation things on here if you do have to resuscitate.
Nice.
So yeah, it would be a great thing for us to incorporate into our care here. Okay, so the baby's doing great. We decided it could go to the mother's breast. So as long as the baby's staying warm and everything, it's fine for the mother to continue to breastfeed. We don't want to take the baby away from her. We want it to maintain skin-to-skin contact. Sometimes, mostly for the first hour of life, we don't really want to disturb that. It's a bonding thing, and plus it's keeping the baby warm. And as long as the mother's comfortable and the baby's fine, there's no problem in that. And as the labor and delivery nurse, you're taking care of the mom here anyway, and it's just as easy to look right here at the baby as it is to take care of the mother. So after 5 minutes, we will assign APGAR scoring again. So we'll do the same little assessment. Now this is not the initial baby assessment that we would do to admit the baby to the nursery. This is just the quick assessment so that we are able to assign APGAR scores and to make sure that the baby is transitioning good for the first few minutes of life, because usually if something's going to happen, it's going to happen in those first few minutes of life.
Okay.
So, I think, the protective environment. One thing you do want to do while the baby is still attached to the mother, as far as the breastfeeding, we can go ahead and put our identification bands on. We want to check the numbers, make sure they all match. the mother, the significant other, and the baby's 2 armbands should all match. We would put those on, and then we would also put on what we call here the hugs tag, or the safety band. And that really pretty much completes what I have to talk about here. Does anyone have any questions regarding the initial resuscitatory efforts of the baby?
No,
No?
it was very clear, thank you.
Okay. Well, thank you very much, and we'll be having a test over this later.
Test? Oh, no
Yeah,
test.
later in this semester. Thank you very much.